All right. Now, once again on this chart, very complicated. That's why we break it down into smaller parts. Now, in this part here, we're looking at the highlights of the chart using what we call section part 3. Okay? So essentially what is this? We're talking about the sources of estrogen and the estrogen pool. We have to have enough estrogen in the body for a woman to have a menstrual cycle, and when that estrogen pool gets low enough, that is when menopause will occur. So estrogen is the key component of what's going on here. Estrogens are created either inside the body or come from sources outside the body. Now, we described in section A one source of endogenous estrogen being the conversion of cholesterol into various other hormones, right? So, as we said before, endogenous, meaning inside the body, estrogens are produced in the ovaries, adrenal glands, in the placenta, and in fat, in the adipose tissue. If there's an imbalance of bad bacteria in the intestinal tract, estrogens can be produced there as well and reabsorbed into the bloodstream. This causes an increase in the estrogen pool of the body. So you see here, we have this situation here in the intestinal tract. It can actually cause an increase in estrogen, so we actually have to make sure that we keep the digestive tract healthy, or we can get excess estrogen, and that will disrupt the menstrual cycle as one source. Now also, we can have excess amounts of insulin in the body, can also increase the amount of estrogens produced. You see insulin here. So if insulin goes up, which is because of blood sugar imbalances, then we can get added insulin added. When insulin increases, like here, and here, we can get extra estrogen in the body. Extra estrogen is produced. Now also, let's talk about fat. An excess amount of fat in the body can produce a greater amount of estrogen through conversion of aromatase. And aromatase is an enzyme in the fat. So there are individuals who have had cancer, and as part of the chemotherapy after cancer, perhaps it's a mastectomy is done, that is an estrogen receptor positive cancer. So in order to keep the estrogen levels reduced, an aromatase inhibitor medication is prescribed to that woman, which helps to keep the conversion of fat into estrogen down, so that there's not a stimulation of the estrogen positive or the estrogen stimulated cells that were the cancer cells. So that's where fat comes in. So we have a variety of different endogenous sources of estrogen. Now we also have exogenous sources, and these come from things like hormone replacement therapy, drugs, from oral contraceptives, and there are some secondary or residual hormones that may be found in meat and dairy products because of the production of those animals. Now, there are also things called xenoestrogens, which xeno means from the environment, from the outside. So xenoestrogens are also found in the environment. And these xenoestrogens are estrogen-like substances that also act on estrogen-sensitive tissues. Now, what are some of the xenoestrogens? Well, they include things like pesticides, drugs, fuels, and plastics. So when those external substances come in the body, then they can cause an estrogen-like response in the body. That can disrupt menstrual cycles. That can create problems with infertility. And many of these xenoestrogens, these outside estrogens, have been proven to cause cancer as well. So one of the things that we do in this clinic is we talk to people about water and outside influences of chemicals and how to eliminate those. and to keep those from coming in the body. So it's very important to actually have the proper filtration system for your water. And I always recommend MultiPure because we know that it helps to remove these things. To keep from getting too many outside estrogen in the body, which will disrupt the hormone balance. Now, obviously, our bodies change and adapt to changing environment. And this has happened over tens of thousands of years. Now, these xenoestrogens are a fairly recent phenomenon, fairly new, that the body has had to take a look at these just recently. And the great majority of these xenoestrogens were created during the last 60 years or less. So this is a very, very new thing. So as with any form of estrogen, xenoestrogens have to be metabolized in order to excrete them from the body. I talked about in part B, where we have to get rid of those excess estrogens in order for the body to work properly. Now, until these xenoestrogens are cleaned from the body, they influence the body in detrimental ways, in bad ways. This additional unnatural load of estrogens requires additional cleaning by the liver. The liver usually acquires and requires additional support in the form of supplements to deal with this toxic burden efficiently, because it's used to just removing natural hormones, natural estrogen, but this extra amount of estrogen-like substances from the outside puts an extra burden on the liver, and it's not used to dealing with that. So we actually have to supplement the body and the liver in order for it to properly clean these toxins out. So in any kind of just a health process as well, especially even so in cancer situations, we have to really support the liver in cleaning these external estrogens as well as the internal estrogens out so that they are not causing a promotion of the cancer. So let's go on to part D of this process.